You need to make an important phone call regarding a patient on the ward. So, you decide to use the telephone in the doctor's office, where it is quieter. As you open the door, you accidentally knock an FI1 colleague's bag on the floor, and what appears to be a small bag of marijuana falls out. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Get advice from a senior nurse on the ward about what to do. B. Go back to the ward and confront your colleague about what you have found. C. Immediately contact your educational supervisor about what you have found. D. Pocket the bag of marijuana for yourself and don't mention it to anyone. E. Talk with your colleague in privacy and ask them to explain, encouraging them to talk to their educational supervisor. Answer: HEABD. The General Medical Council's duties of a doctor states that in situations where you suspect that your conduct or that of a colleague may be compromising patient safety, you have a duty to act without delay. In this situation, possession of illegal substances is wrong regardless of the person's profession, and you have a duty to be honest, trustworthy, and act with integrity. Option D is therefore the least suitable response. There is a professional duty to raise concerns, but you should speak directly to the colleague in question in private first to give them a chance to explain themselves and to help maintain a good professional working relationship. Option E is therefore the most suitable response in preference to C, while B would be inappropriate. Option C would be suitable further down the line if the colleague in question did not rake any further action themselves. Asking a senior nurse for advice may be appropriate. However, they do not have a direct supervisory role and are therefore a less suitable person to approach than your educational supervisor. Your consultant is attending an emergency in theater with the registrar, and you're the only doctor available for the ward. A senior nurse approaches you, asking you to obtain consent from Mr. Jones, who is already running late to be prepped for a laparoscopic cholecystectomy. This is a procedure that you have observed many times as a medical student in FI1. Choose the 3 most appropriate actions to take in this situation. A. Approach the patient with all the relevant paperwork, apologize for the delay, and gain consent for the operation. B. Call your consultant in theater and tell him that he needs to attend the ward to obtain consent from Mr. Jones for his operation. C. Explain to the nurse that you have not been trained in carrying out the procedure, not have you been given training to gain consent. Therefore, it will be inappropriate to do as she asks. D. Explain to the patient the reason for the delay in going to theater, but that a doctor will be with him as soon as possible to complete the paperwork. E. Get advice from another doctor who is qualified to perform the operation, and explain the situation, asking whether they would mind coming to the ward to gain consent from Mr. Jones. F. Give Mr. Jones a patient information leaflet. Ask him to sign the form and explain that you will collect it when you get the chance. G. Inform theater that they should cancel Mr. Jones's operation as he is not yet formally given written consent. H. Tell the nurse that you are just too busy with more urgent patients and that Mr. Jones will have to wait. Answer: GDA. Informed consent is always required before any procedure, and to be qualified to gain consent, you need to have had training either in carrying out the procedure or in gaining consent for it. As an FI1, option C would therefore be appropriate, but option A would not. If you're unsure, getting advice from another senior colleague would be sensible, and if someone else were able who was trained in the procedure, they could gain consent. You must always make the care of your patient your first concern, so communication of the circumstances to Mr. Jones D is also courteous. Option H is inappropriate as it is neither polite nor conducive to maintaining positive professional relationships. Although it is unfortunate that Mr. Jones has been waiting, his situation is not life-threatening, and therefore attending to his problem has to be prioritized below that of the patient currently being operated on by the consultant. B. You must give patients information in the way they want and can understand. However, While a patient information leaflet can be an effective way of relaying clinical information, the patient needs a conversation with a doctor about the procedure and its risks and benefits prior to giving consent. So option F is therefore inappropriate. Option G may be suitable, but it is a bit drastic in this situation.